Now, if hospitalizations spiral out of control, healthcare systems will need to make tough decisions. And if beds and supplies are running low, they'll have to prioritize patients. But who gets more focus than another? A plan is now in place, only to be used in a worst-case scenario. 3 News Now investigator Jeff Van Sant has more on Nebraska's plan.
Several healthcare systems across Nebraska have created a crisis standards of care guidelines, only to be implemented in the most dire of situations, like running out of beds, staffing, or supplies.
The overall goal of crisis standards of care planning is to enable healthcare providers to do the most good for the greatest number of patients.
Endorsed by the Nebraska Hospital Association and the Nebraska Medical Association, the guidelines are based off one developed in Massachusetts and changed to fit the needs of our state.
I do think that it's important to think about all this work to kind of come together as a state and have a guideline and to get broad engagement from lots of people everywhere. It is to ensure that, okay, how do we do this best and never reach a point where we're having to kind of make choices that no one wants to make.
If tough decisions are to be made, a triage team is set up. It would measure survival chances of a patient using a point system. Those with the best chances of survival get the highest priority. Health officials say everyone will receive some level of basic care, even though it may not be life-saving for some.
All patients are treated with respect, compassion, without regard to race, gender, age, sexual orientation, disability, ethnicity, ability to pay.
Healthcare officials say it's a scenario that weighs heavy on their hearts.
There's a great deal of moral suffering that occurs for healthcare providers. And if you were in the situation where you felt like you did not have the backing of objective measures, you did not have the backing of other clinicians, you did not have the backing of this document, it would just further compound that moral suffering.
Crisis standards of care is not just for COVID-19. It can be used during any crisis or mass casualty event. Health officials say Nebraska is nowhere near having to implement something so drastic. If a rural health system is getting overwhelmed, other facilities like here in the metro would step up and vice versa.
We have these entities called healthcare coalitions, and there's 6 of them across Nebraska, and they connect all of the healthcare facilities in a given region. And that really allows for some of that sharing of resources and distributing, staff or stuff or whatever the case may be to ensure that care can still be provided.
It's about preparation, being ready for the worst, so health systems are organized and the battle plan is in place.
When a triage decision is made, it's proportional to the degree of the emergency. And then there's finally a sense of common good and solidarity that when there's limited resources, all people must consider the greater good of the entire community.
Jeff Van Sant, 3 News Now.
For more on this story and all of our investigative team stories, go to our website, 3newsnow.com. And if you have a story for our investigators team, you can email it to investigate@3newsnow.com.